Hi, welcome in. Thank you so much for coming today. Please take a seat. I know it's been really hard trying to get appointments in at this time. I know this year has been really crazy for everyone, so I'm really glad that you're able to make it today. Okay, so before we get started, I'm going to just confirm a few things here. Can you just confirm your first and last name for me, please? Okay, thank you. And can I get that date of birth? Okay, perfect. And then can you confirm your street address, please? And zip code? Okay, perfect. Thank you. So, what brings you in today? What can I look at for you? Did you want more of a general checkup, or was there something specific that you wanted me to look at today? General checkup? Okay. It's been a little while since you've been here, right? Yeah, okay. And is there something specific you were wanting to discuss with me today? Right. Okay. So, what kind of allergies are you talking about? Have you noticed that it's something that's seasonal, or is it something specific like an allergy to food or medication? Okay. So it seems to be going on about year-round for you too. Okay. Okay. And is there something that you've been taking, like an over-the-counter medication? Okay, perfect. That's the one that we usually recommend. And has it been effective for you? At first? Okay, right. Yes, okay, so we'll definitely take a look at that today for you. And is it more in your sinus area, or do you notice that you have a cough at all? It's more in the sinus area, okay. And let's see here, do you feel like you have any rashes or bumps on your skin at all? Okay, so it's more of just a congestion thing then. Okay. Alright. And have you been experiencing any bloody noses lately? Okay, good. Alright. And so, since this is a general checkup, let me just take a look real quick. It looks like you don't have any noticeable rashes or anything on your face. And can I see your arms, please? Okay. Yeah. Perfect. Let me see your other arm. Okay. It doesn't really look like you have rashes or anything on your arms, which is good. Have you noticed any rashes on your legs or on your feet or anywhere else? No? Okay. Right. So this is definitely more of just a seasonal, maybe like a hay fever. Okay, you've had hay fever before. Right. Okay. And is there anything else that you would like me to specifically look at today for you? Or was that pretty much it? Okay, so let me just go through a few more preliminary questions and then we'll get into the actual examination, okay? So, do you smoke? Okay. Do you drink? And if so, how many times a week do you drink? Okay. Perfect. And is there any family history of diseases that you know of? Okay. that one's very common, unfortunately. Okay, and have you had any surgeries? You have? Okay. So you've had mouth surgery. Okay. Okay, perfect. And have you noticed any changes in appetite? No? Okay. How about in sleep patterns? Okay, so some. And you do have some insomnia sometimes? Okay. Okay. Oh, you did do a sleep study before. Okay, yeah. You went to the sleep clinic that we recommended before? Perfect. Yes, yes. I'm very glad you did that. Okay. Beautiful. So, has there been any medications other than the over-the-counter that you were talking about that you've been taking? Okay. Just occasionally? Perfect. And have you been taking any prescription medications recently? Okay. And do you know the dosage on that? Oh, perfect. Thank you. Okay, and how many times a day? Okay. And how long have you been taking this for? 3 months. Alrighty. Perfect. So, is there anything else that you would like to talk about today before we start the examination? Okay, so I'm just going to move a little bit closer to you, and then we're going to get started here, okay? Okay, so now that I'm a little closer, I'm going to grab some exam gloves, okay? Okay, so I'm going to first start off by listening to your heartbeat, okay? So, have you felt like your heart has been pretty normal, that you haven't gotten too overexerted? Okay, good. So I'm just going to start off by putting this on your chest, okay? There we go. And just breathe normally. Okay, perfect. And I'm going to just place this on your back, okay? And one deep breath in and out. Okay, again, a little bit lower here. One deep breath in and out. Perfect. I'm going to go on to the other side. Okay, deep breath in and out. Perfect. And again, deep breath in and out. Okay, your lungs sound very good, which is a very good thing. So, I'm going to take your blood pressure now, and I should keep these on actually. So, so I'm just going to wrap this on your right arm, okay? Okay, perfect. So, just gonna squeeze. Perfect. Okay. Perfect. Very nice. Okay. So now that we have that, let me record it real quick. Okay. Everything's looking very normal, and I know you're required to take your temperature before entering anyways, so we know that's all set. And right now I'm going to just take a closer look at your skin first, okay? And because you said you were also a little bit concerned that you may have some rashes or irregular bumps on your skin, so I'm going to just take a look at that. And is it primarily your face that you're concerned about? Okay, no worries. So I'm just going to use my light here, okay? And I'm just going to look at your face here. I'm just going to move your hair out of your eyes if that's okay. I'm going to take a look at your forehead. So, let's see. Okay. That looks pretty good. Let me look at your nose here. And I don't see anything that's irregular right now, which is very good. Okay. And your cheeks. Okay. And then let me lift your chin a little. Okay, perfect. Yeah. You know, your face is very, very nice. Your skin is beautiful. You have very, very nice skin, so I don't think you have to worry about any rashes right now. And okay, so let me just continue with the overall checkup, okay? So let me just take a quick look in your eyes just to make sure that the light response is correct. Okay, so I'm going to shine this light in your eyes. Okay, I'm just looking. Okay, and your other eye here. Okay, so what I'm going to do is I'm going to just move the light across your eye, on both eyes, just to make sure that the light response looks completely normal, okay? Okay, so that looks good. Okay, I'm going to do your other eye now. Okay, perfect. Yeah, good, very good. And you said your eyesight is 20/20. Yes, that's very, very good. And I do see here on your chart that you did just have an eye exam recently. So, okay, perfect. And now what I'm going to do is I'm just going to do a tap test on your body. So I'm just going to do that on you, okay? And just let me know if there's any painful spots. You shouldn't feel any pain when I'm doing this, okay? So, like I said, just let me know. Don't feel afraid to say anything, okay? So I'm going to start on your collarbones here, so good. Okay. Okay. Good. Okay, I'm going to start on your sternum. Good. Good. Okay. Now I'm going to go more to your abdomen area. Okay. So, good. Okay. perfect. And then I'm just going to tap your sides. I know some people are a little bit ticklish, so just bear with me here. Okay, good. Good. Okay, perfect. So no pain at all. Okay. So let me go through this process with you and just give you kind of a little bit of a facial massage, if that sounds okay. And this is what I do to clear my sinuses. And even though we're going to be prescribing something to you later on, I just want to let you know that there are other remedies other than just the traditional medicine here that we have, okay? Okay, so I'm just going to start off right at your temple area, and what this is going to do is it's going to relieve a lot of the pressure that builds up along our temples, okay? And it's going to relieve some of the sinus pressure that we have, since everything is connected here, our eyes, nose, and throat, okay? So I'm just going to start by going right at your temples, right there. Yes, okay? So by putting some pressure just right there, it's going to actually relieve a lot of the pressure built up. Yes, so these are facial massages that you can do daily that is going to help with a lot of that pressure, okay? Okay, so just right there at the temples. Yeah, right there. Perfect. Does it feel any different? A little bit? Yeah, you haven't massaged that area before. Okay, now the next part is going to be right up on the cheekbone area and this jaw hinge area. So we eat a lot of food every day, at least I do, and we're always talking and, making facial expressions, and our jaw gets used a lot, and that can actually lead to tightness and headaches. So if you're experiencing any of that, this should also help relieve that, okay? So it's just right here. I'm going to put my thumbs and just go right along your cheekbone area, okay? So there we go, right along your cheekbone area. Yeah, okay. Perfect. And you can just put some pressure there and hold it for a second, and then drag it up. So it's this nice, gentle upward motion. Okay. Perfect. Does that feel a little better? Yeah. And I also like doing some circular motions here too. Okay. So I'm just going to circular motions. Okay. Yeah. Perfect. I'm glad that makes you feel a little better too. And now the most important part, or the one that really is going to help drain all of those sinuses. If you feel really stuffy right by your eye area and your nose, this is the best massage that I do for myself. And it's just going right here and doing an upward motion, and it's just right under the eyes by the nose, and you just gently swipe up, okay? And I know you'll feel a lot of relief just by doing that. So here we go, like that, and sweep out. Yes, this very gentle motion. All of these motions are very gentle. Very, very gentle, but relieving, and you can hold that right there. You can feel that pressure and just drain it out. Perfect. Yeah, you're gonna use those techniques. That's perfect. And while we're doing this, I would like to check if your lymph nodes feel swollen at all, if that sounds okay. And it's just right under here. So I'm just going to gently touch around your neck area and just feel if there's any swelling, okay? Okay. Yes. Okay. I think they feel just a little bit swollen. Is it a little tender when I'm doing that? Just a little. Okay. Yeah. So what we're going to do is just gently massage that area, okay? And if there's too much pressure put on it, it's going to be very painful. So we're just going to be very, very gentle about it, okay? Okay, so just gentle movements again. Beautiful. And something that also helps a lot is going to your ears and pulling down. And when you feel that there's a lot of pressure there, just open your mouth like ah, and flex your jaw. Do that on both sides, and it will actually help you hear better, even if there's at all a little bit of blockage, because we think about our sinuses and our throat, but our ears are actually all connected to that too. So you can pull your ears and even move your eyes around, and your eyes are all connected to your ears too. So that also might help relieve some of that pressure and heaviness that you feel in your face and head area, okay? But I would definitely recommend massaging your temples, doing a nice gentle massage on your temples and on your jawline and your cheekbones, and then right in the center and coming up and out, okay? Okay, I hope that helped. I know it's not really something that the doctor usually recommends, but if there's something that you can do at home that will help, I think that's a really good option to have. Yeah, okay, perfect. So let me just take a look one last time. Just give you one more check over here. Okay, perfect. It's looking like you don't need to go to the dermatologist at all. You already had your eye doctor appointment, and I just checked your eyes, and everything looks really good. Yeah, okay. And your hair is beautiful too. It looks like you take really good care of your scalp. You keep it well moisturized. That's good. And the rest of your skin looks good. And do you apply moisturizer too after you take a shower or a bath? Yes, okay, good. That'll keep your skin very healthy. Okay. Perfect. So let me go meet with the doctor, and I'll be right back with your prescription, okay? So I just consulted with the other doctor, and I wrote a prescription for you here, and I actually filled it and just picked it up at the pharmacy here at the hospital to save you a trip. So it's called Montelukast, and this is going to be the generic brand of Singular. Okay, and so it's a 10 milligram tablet, and you're going to just take one before bedtime every night. Okay. And this is going to last you, like I said, 90 days. Okay, so it may cause some slight drowsiness, but other than that, it's a very good and effective pills that you can take for your allergies. Okay, and then just pair that along with the the different massages that we went over today. Okay, so here you go. And I also checked with your insurance. Everything is covered for today, so there's going to be no out-of-pocket cost for this visit or for the prescription. So just make sure if the hospital bills you, just tear up those bills, ignore them, consult with your insurance company first before ever sending any money to the hospital, okay? And don't worry, like I said, it's all taken care of, so you have no cost to you, okay? I'm just so glad that you were able to come back in today, and I was able to give you one last check over before I become the official doctor here at this office. The old guy is retiring, so yeah, we've been working together for a few years now, but yeah, I'm really glad that you transferred over to be my patient, so thank you so much for coming. It was wonderful to meet you. Yes. I hope you have a good day, and I hope it's not a few more years until I see you again. Okay? Alrighty. So, I hope you have a good one. Alright. Bye.